Hey guys, today we're going to be talking about flossing. Not talking about flossing your teeth, we're going to be talking about nerve flossing. So we're going to start a new series on nerve entrapments. So this is something that you can do at home. First nerve we're going to be talking about the sciatic nerve. Before we do that, let's actually go over the anatomy really quick of what we're trying to accomplish. So we've got our spine. All of our nerve roots come out of these little holes. Got our disc like a jelly-filled donut and our spinal cord. So if you picture our brains up here, connects with our body through our spinal cord, and all these nerves come out. So what the sciatic nerve is, main nerve that comes all the way down the back of the leg. When people have sciatic nerve issues, they get that lightening or that pain that goes all the way down the back of their leg, all the way down to their foot. So reviewing, what do nerves not like? Nerves do not like to be stretched, as in pulled, and nerves do not like to be compressed. Just like you don't like it when someone gets on your nerves don't either. Okay, so we've got our sciatic nerve. This poor patient right here has come into our office with sciatica. So below here is where the sciatic nerve would be coming out. So we've got the spine. So picture this is the nerve coming down the back of his leg. From here up would be the spinal cord. Well, if we don't want to stretch the nerve, and actually an orthopedic test that we do to confirm that it is entrap nerve is called a nerve tension test. And so what we would be doing is we'd be stretching the nerve, pulling it tight. Nerves don't like that. Reproduces the symptoms. We do know, in fact, that he has an entrap nerve. So if you think about this nerve is attached to the foot all the way to the head. We can move this nerve in one of two ways. If he moves his foot forward, this nerve is going to pull, stretch, and it's going to move downward this way. The opposite's going to happen if he moves his head down like this. It's going to pull it this way. We do not want to move both the same way at once because that's going to stretch this nerve, irritating it more. What we want is his head to go opposite of the foot, and that's how you effectively do this flossing. Think of a piece of spaghetti or floss. We want it to go back and forth because what we're trying to do, we're trying to free this entrap nerve up. So his foot is going to go that way while his head's coming this way, which is going to glide the nervous tissue down this way. We're going to go back and forth just like this. When you start this at home though, you can go and relax right there. When you start this at home though, keep in mind, a lot of times this nerve root can be very irritated. So start really slow, only a couple of reps. If the symptoms get worse, shut it down because we can have a lot of inflammation, a lot of irritation in this nerve root. If there's no symptoms that are getting worse, we can increase the reps. But go ahead and try this at home. Hope that this helps.